The future for Lyme patients is positive because we have new and modern tests like the tick-borne basic and tick-borne plus for persister forms, round body forms, and also the co-infections. We have better tests. We have also better tests now for the cellular immune responses like ELISpots, iSpots. We have also the good option now to check the immune system with different CD markers, not just CD57 markers. So the future for the diagnostics is positive. For the therapies, yeah, we need more studies on that. So there's a lot of experience in the studies, but we need definitively more outcome evidence-based medicine, not just to say this method is the best or helps 100% of the patients. My experience, this doesn't help. We need evidence-based medicine. We need accredited test systems. All of our test systems are accredited, certified, IVD registered. So that's the way for the future. But my concern is therapies that we are too much in the experience field of experiences and not in the field of evidence-based. All of these patients we diagnose have immune dysfunction. All of these patients with Lyme disease and co-infections have the infection for sure, different infections from the ticks. And also we have the third eye, the inflammatory part, the inflammation part we need to diagnose and treat. And maybe to mention also that we know now that every patient has multiple infections, chronic multiple infections. Some are maybe opportunistic, some are maybe we find lots of viruses, we find lots of parasites, we find lots of yeast and mold. We have a lot of good tests for that now. We need to know what to treat. So the diagnosis is the first step we need to do, and then we can treat. And every patient is different from the other patient, so we don't have a wonder drug, a wonder pill for all of them, one size fits all. That's not possible because every patient has different profile from different infections. And maybe also to mention, in the end, not everything is Lyme disease. So the hope is not to get better tests, but maybe to standardize more the tests and to standardize more the therapies and not to sell therapies as a selling concept in different webinars, which is now happening. So we need a true way for the patients, not to sell by some so-called experts. This is not the way we want to do. I'm on the ILADF board now, the International Lyme and Associated Educational Foundation, which is the scientific part from ILADS in America, and really also our President Garth Ehrlich and my person and the other on the board, we really decided to bring evidence more into medicine so that we have the chance to change all guidelines for you patients. That's really, really important to change the guidelines. So the acceptance of chronic Lyme disease and chronic infections, chronic co-infections. So we need the acceptance. We also need to prove that co-infections can get chronic. In the teaching books, it's nowadays not so mentioned. But you never walk alone. We all stay together with you, and if we can help, we help. We do really our very, very best. Not just this month. This is like a mission, and I would say the mission is possible and not impossible.